Welcome back to the channel. Today we're diving into one of the key biologic therapies used in the treatment of systemic lupus erythematosus, Benlysta, also known by its generic name Belimumab. If you're a patient, caregiver, or healthcare provider, this video will give you a clear, thorough overview. From how it works to who it's for, how it's given, and what to expect in terms of benefits and side effects. Before we begin, this video is for education and inspiration only. It's not medical advice. Be sure to consult a healthcare professional and double-check information with trusted sources. Benlysta is a fully human monoclonal antibody that targets a specific protein in the immune system called BLyS, short for B lymphocyte stimulator. This protein helps B cells survive and mature. In lupus, B cells are often overactive, producing autoantibodies that attack healthy tissue. Benlysta works by binding to BLyS, reducing B cell survival and ultimately lowering autoimmune activity. Benlysta was approved by the FDA in 2011 for systemic lupus erythematosus, and more recently, it also gained approval for lupus nephritis in 2020, making it the first biologic specifically indicated for kidney involvement in lupus. Benlysta is indicated for adults and children aged 5 years and older with active autoantibody positive lupus who are already receiving standard therapies such as hydroxychloroquine, corticosteroids, or immunosuppressants like azathioprine or mycophenolate. It's used for patients with autoantibody positive lupus, persistent disease activity despite standard therapy, and those with lupus nephritis when added to standard therapy. It's important to note that Benlysta is not approved for treating severe CNS lupus or active severe lupus flares. Benlysta can be given in two ways: intravenous infusion or subcutaneous injection. IV Benlysta is administered at a clinic or infusion center, typically once every 2 weeks for the first 3 doses, then every 4 weeks. Subcutaneous Benlysta is a weekly injection that patients can give themselves at home. The subcutaneous option has really improved convenience for patients who want to reduce visits to infusion centers. In clinical trials, Benlysta showed significant reductions in disease activity, flare frequency, and corticosteroid use, especially in patients with high disease activity, low complement levels, and positive anti-dsDNA antibodies. For lupus nephritis, adding Benlysta to standard therapy increased the likelihood of renal response and delayed progression of kidney damage. Patients don't typically feel results overnight. It often takes 3 to 6 months to see full benefit, though some begin noticing improvement earlier. Like all immunomodulators, Benlysta carries potential risks. The most common side effects include nausea, diarrhea, injection site reactions, fatigue, and headache. Less commonly, patients may experience infections, including serious infections, mood changes, including depression and suicidal thoughts, and hypersensitivity or infusion reactions. This is why regular follow-up and lab monitoring are essential. Most providers will track your CBC, renal function, and disease markers to ensure both safety and efficacy. You and your provider might consider Benlysta if you have moderate to severe lupus activity despite standard therapy, you're struggling with steroid tapering, you have lupus nephritis and want to preserve kidney function, or you prefer a biologic option with a more targeted mechanism. As with all lupus treatments, Benlysta is part of a comprehensive care plan, not a standalone solution. It works best when combined with lifestyle management, routine monitoring, and consistent communication with your rheumatology team. Right now, Benlysta is still the only biologic specifically FDA approved for lupus nephritis. However, other agents like rituximab are sometimes used off-label, and new drugs like anifrolumab, also known as Safnelo, are emerging for SLE treatment, each with their own mechanisms and data. So, is Benlysta right for you or your patient? It depends on multiple factors: clinical history, response to prior treatments, lab data, and personal preferences. Benlysta targets BLyS to reduce B cell activity. It's FDA approved for SLE and lupus nephritis. Subcutaneous and IV options are available. It reduces flares and lowers steroid burden. It requires months to reach full effect. And side effects include infections, GI symptoms, and mood changes. If you found this video helpful, hit that like button and subscribe for more deep dives into rheumatology meds and autoimmune disease management. See you next time.